Dr. Vanderzwan, you see a lot of doctors who are talking to patients and talking specifically to seniors. What are you hearing from them? What do they want to know about the medical cannabis regime, and what are they even interested in on the recreational side as well?
Right. Again, I've been operating in the medical cannabis space for 3 or 4 years now, and one of the interesting shifts I've seen, certainly over the last year, is an increased interest in the elderly population around cannabis. A lot of reasons why. I think one of the main reasons being is they're not too impressed with the conventional medications that they've been forced to take. They're well aware of the side effects that come with that medication and the negative impact on their quality of life. And they're looking for alternatives, and certainly their family members are looking for alternatives as well. So there's a lot of curiosity around what cannabis is. I think they're a little bit surprised to learn at times that it's no longer just smoking or using a bong. There are all kinds of more palatable options for an elderly population. Specifically, the interest in cannabis oils is a huge selling point for cannabis as an option for them. And new delivery options are becoming available as we speak. So certainly opens a lot of doors for them, and they're much more accepting of that as an option.
Yeah, I mean, my shorthand that I use, and I'm not a doctor and not as qualified as you, but lots of people are taking 10, 12 medications every day. They'd like to be taking something less than that. This can maybe take away some of them.
Yeah, definitely so. And that's one of the big advantages in my mind of cannabis as a potential therapy is its ability to address the issues and the concerns around polypharmacy. You're absolutely right, Jay. A lot of elderly people are taking multiple medications and addressing multiple symptoms with those medications. Cannabis has been shown to be effective in both clinical and preclinical studies at managing a number of symptoms: pain, sleep, anxiety. And if you can treat all of those issues with one med as opposed to 3, I certainly think you're going to be better off.
Yeah, and I think so too. And I've seen it even in my parents and their cohort. They're asking a lot more about it. They're much more accepting of it. And it is this thing like, not that I have nothing to lose, but I've been taking these medications for so long, and I'd like to not be taking some of them. And this may help more than one, but also improve my quality of life overall.
Absolutely, yeah. And quality of life is the real issue here, and that's what I hope to do as a physician, is improve patients' quality of life. And if I can do so by not only addressing their symptoms adequately, but reducing polypharmacy and reducing the side effects associated with polypharmacy, I think I'm doing my job.
Yeah, and that's really why we thank you for your partnership on green+silver, which is coming up on October 11th and 12th. It's really what we wanted to do. We wanted to talk about a lot of the issues facing older Canadians as it relates to cannabis. We're calling it cannabis and optimal aging because some of it is around the medical side. Some of it is around they need to know more about the recreational side too as it becomes available. And then something I can call in the middle sort of wellness, broadly defined, is that increasingly in places like California and Colorado, what we see is really becoming part of wellness regimes as well as medical and recreational. But there's something, I don't know if it's right in the middle, but it's something around wellness.
Right, yeah, and we're certainly seeing that, and I think you're going to see that part of the market open up and be a big potential market in Canada.
Yeah, and it's why sort of partners like you at WeedMD and others are really interested in talking to this population of seniors, talking to the population that's caring for seniors, whether it be medical or family or other. And even, I think, really importantly, talking to the cannabis industry about what you are hearing about from sort of patients and families. What are people actually interested and concerned about? I think that's what we hope to shine a light on the industry as well, that this is a population not to be forgotten, but really to be embraced and educated.
Yeah, absolutely. And sort of going back to what you mentioned in terms of what they're looking for, and I think this will play a bigger role in that sort of in-between space that you're talking about between medical and recreational, more the lifestyle, is different delivery mechanisms. So we're already starting to see gray market sources of cannabis products like topical rubs for muscle pain. I think that will become more prominent as the industry grows and as it expands and these new options become available. So it's going to be interesting to see where it fits.
Yeah, it is, and it'll be interesting to watch from an industry perspective, sort of watching it, but it'll also be interesting, I think, during the green+silver sort of events to hear what people are actually talking about, because there is a great deal of excitement, certainly from an industry perspective, and I think even from a population perspective about legalization, but how does that actually boil down to older Canadians?
You caught me.
No, it's good. But this is what we want. Like, we want to have these discussions, frank discussions, less about sort of panels and hearing people sort of preach or talk, but actually hearing from an audience about what they're interested in, and actually answering questions that are not just FAQs necessarily on a website, but actually FAQs from an audience.
Yeah. It's going to be interesting. I'm curious to see how it plays out with the elderly population. I think there's still unfortunately, we exist in a culture where there's a lot of stigma that still dominates around cannabis use. And I think the elderly population, I think they recognize that in some sense they are a vulnerable population. So I think they may be a little bit less likely to sort of venture out on their own at the Ontario Cannabis Store and experiment with products. I think a lot of elderly individuals are going to still want the option and prefer the option of accessing product and advice and education through a reputable source, meaning their primary care provider. So I think that's still going to be the preferred mode of access for the elderly patient. But I think probably over time, as that stigma starts to lift and word starts to spread, you may start seeing more of a foray into the adult use market.
Yeah, it's really interesting to watch, and I look forward to watching it with you, but also gaining expertise from you because you're out there every day talking. Thanks for joining us here today.
Yeah, thanks for being here, Jay. Thanks for having me.